Good afternoon, everyone, and thank you for your patience as we get started here this afternoon. My name is Mike Cooper, Parish President for St. Tammany Parish. Today is Tuesday, May 12th, 2020. I want to welcome our elected officials, staff of St. Tammany Parish government, the press, media, and other guests that are here today. Thank you for attending this. Today, I'd like to formally announce our Phase 1 reopening plan for St. Tammany Parish, in which we will have a plan for businesses, services, activities, restaurants to open on May 15th in a phased, gradual manner, of course. So effective this Friday, churches, gyms, fitness centers, movie theaters, barbershops, hair salons, nail salons, and restaurants, which were either closed or curtailed from opening, may now open at 25% capacity per the state fire marshal's requirements. Massage establishments, spas, tattoo parlors, and all other places of public amusement will remain closed. On Thursday, I will issue a new executive order which outlines the above and will be in effect for 21 days. During this time, there will be requirements placed upon the businesses and customers who patronize these businesses. Employers will require face masks where there is public interface. Hand sanitizer availability must be at each entrance of the businesses. You must practice social distancing, wash your hands regularly, and customers, clients are strongly encouraged to wear masks when out in public. The Live Safe, Work Safe, Shop Safe action plan is a result of our Economic Recovery Resiliency Council. The efforts that they provided will provide a sustainable reopening of our local economy while monitoring the ongoing pandemic and the impacts of public health. I want to thank the Advisory Council, led by St. Tammany Corp's CEO, Chris Masingill, for their tireless commitment over the past 2.5 to 3 weeks in which they provided this product for us for this phased reopening. I'd like to call on Chris at this time to say a few words about the work of the council, the Advisory Council, and what they've provided to us moving forward, not only in Phase 1, but in Phase 2 and 3 beyond. Chris?
Thank you, Mr. President, and thank you for including economic development in this important project. We can certainly say on behalf of the St. Tammany Corporation there is no other important project during this time frame than putting economic development in a position to help our businesses reopen and get our economy restarted. We appreciate the opportunity to be a part of this effort and appreciate your leadership and the leadership of our council and other elected officials. Chairman Lorino, thank you for your ongoing guidance and counsel. As many of you all know, on Monday, April the 20th, President Cooper announced the creation of the St. Tammany Economic Recovery and Advisory Council. We went to work immediately at his direction, researching, evaluating, collecting, having in-depth conversations and meetings about best practices, industry standards, public health recommendations, including recommendations at the federal, state, and other jurisdictions across the country as good models, including CDC and the White House Coronavirus Task Force Plan. On the 24th, the first draft was submitted in preparation for what we were hoping then to begin Phase 1. We now know that the governor extended that, and we went back to work, continuing to refine the plan and in taking additional community input, meeting directly with St. Tammany businesses and business owners. It was important to President Cooper that we always maintain the principle of getting our economy reopened in a steadfast, a swift, responsible, and a sustainable way, by always protecting public health and trying to balance the economic health of St. Tammany Parish. That was always a guiding principle from the President. We continue to meet with industry-specific focus groups. In fact, we collected almost 1,200 direct constituent inputs and communications into the St. Tammany Corporation and the Advisory Council in the course of this process. Feedback that helped directly shape the current plan that we have, including elected officials, business owners, specific groups that we knew was already dramatically impacted, but also had an important perspective on how we implement, how we move in to the various phases based on letting the data help drive that decision for a gradual phased opening. All of these things shape the recommendations that we have here today, and then we quickly, on an accelerated time frame, completed the final draft, turned it in to President Cooper on May 8th, and the official submission is what we have here today. The plan is really structured in two major components. One, what we call our reopening continuum. It's the phases. We actually color code those phases. We were in the red phase. Now we're in the orange phase, or phase one. Now we have a 21-day review and gating process that was established by the state. The primary guiding principle as we enter into phase one has really two main directives. The first one is an overall limitation on the capacity of businesses and entities and organizations as they begin to reopen. The second one is maintaining those safety protocols and the social distancing that is required from public health. Those are the two guiding directives as we enter into phase one. The President mentioned a few of those, but let me just go over again some of the ones that were particularly impacted that we had a lot of engagement with. Obviously, essential businesses that was determined by the CISA will continue through this phase. But most importantly for here, we knew we had the ability to engage with restaurants, coffee shops, cafes, can start their indoor table services. Places of worship can begin their indoor services. Gyms, fitness centers, movie theaters, barbershops, of course, hair salons, in which you can probably notice I am in need of one of those myself and looking forward to getting back into seeing my hairstylist. The other part that was important was youth activities, including youth recreation, non-contact sports, day camps, and summer camps. Those were important, as you can imagine, going into the summer. Office-based work, expanded governmental services, large venues like the Harbor Center and others can begin to operate with the 25% reduction. Now, closed businesses. It's important that we understand the ones that still need to remain closed as we enter into phase one. These are bars, particularly bars that do not have the LDH food permitting. That's an important distinction. The pool halls, the contact sports, children play centers, playgrounds, theme parks, adult entertainment venues, and other similar types of operations continue to remain closed. The other thing that we'd like to do today is share with you two pieces of helpful information. We're excited to roll out to you what we're calling the St. Tammany Safe website. This is an online portal that you can go and get real-time information. It's got downloadable guidance and pieces of instructions and tools and resources that you can go to in real time to look at as you're thinking about what does it look like for implementation, what does it look like as it relates to the restrictions for my businesses, and the details about how to specifically transitioning from being closed to the gradual reopen by maintaining that 25% occupancy limit. The other one is our Live Safe, Work Safe, Shop Safe helpline. And that number is 985-809-1411. Again, that's 985-809-1411. You can call that number. You will speak to a live person, and we will walk you through the individual guidance as it relates to your specific industry. I had mentioned to you the two elements of the plan. The first one was the continuum table, and the second one is industry-specific guidance. We will walk through that with you. We will go through every element. We still know there's going to be some clarification when the governor puts out his executive order that will help us in those definitions of some of these aspects. So call us. You will speak to a real person. It was important to the president that we had these technical assistance opportunities available for our businesses. The other thing that I would say in closing is that we too have to remind ourselves that the adherence to the social distancing guidelines, recommendations for wearing the face coverings as we go into the phase 1 guidance of operations for our businesses continues to put St. Tammany in the strongest position possible to reopen our economy so we can get back to the things that we want to do. This is not over. The pandemic is not over. But for us, it's about jump-starting our economy, and I want to say a particular thank you to President Cooper and the members of the Advisory Council. You had almost 20 community and business leaders putting hours worth of time on a quick schedule to make sure, because it was that important, that we got it right, that we provided the right kind of information to our government officials, and we really appreciate their participation. So with that, thank you very much, and thank you, Mr. President, for giving us the opportunity.
Thank you, Chris. And what an asset we have with Chris MASINGILL, his group at St. Tammany Corp., the Advisory Council that has provided this roadmap for us moving forward. We were prepared with this plan to move forward on a parish-by-parish basis or region-by-region basis had the governor declared yesterday that that would be an option. That's how good and how thorough this plan is and how it has prepared us. This is a roadmap for us in the future for phase 1, phase 2, and beyond. Others with me up here at the podium, and will be speaking in a second, is Dr. Charles Preston, our St. Tammany Parish Coroner, Chairman Mike Lorino of the St. Tammany Parish Council, and Clarence POWE, the Director of Homeland Security and Emergency Operations for St. Tammany Parish. They'll be saying a few words in a second. At this point, I'd like to call on Dr. Preston. He's our Chief Medical Officer. He has been by my side since day one when we first introduced the executive order back in the middle of March when we first addressed the ongoing pandemic that we face here in St. Tammany. Dr. Preston?
Thank you, Mr. President. I have had the privilege of working with the President's Advisory Council on Economic Resilience. I have been come to know lovingly as Dr. Buzzkill because I keep focusing back to certain realities. One of the realities is the virus has not changed. Just because we're beginning to reopen business, that is not a signal that we're out of the woods and the pandemic is over. And I want to thank all of you who are protecting my health by wearing a mask when you're in this room with me. We have met the gating criteria in terms of hospitalizations, ICU admissions, vent utilization, and even the death rate has begun to come down slowly. In the last 2 weeks, we had 40 COVID-19 deaths. 32 of them happened in senior living centers. I am very happy to say that DHH has formed strike teams of infection control specialists with partnerships with local hospitals to try and go into those living centers and mitigate those risks. From the very beginning, everybody understands, and I'm sure you do as well, that there is some risk when we start to get back together. And so our job is to mitigate that risk. And it's really the same message you've heard from Anthony Fauci to the governor down to the lowly coroner. Wash your hands, cough in your elbow, social distance, and wear a mask. Every single citizen is encouraged to comply with that, and it is the same notion as herd immunity. When we vaccinate everybody in a herd, then the disease disappears. We don't have a vaccination, so all we have are those measures to wash your hands, cough near your elbow, social distance, and wear a mask. And so I just want to reiterate, this crisis is not over, but we recognize that we cannot continue like we are. We can't go for a year at a stay-at-home order. People are going to starve. People are going to be in horrible, horrible conditions. We have to move forward, and President Cooper has the exact right plan. We make a change and see what happens. And if we don't go over the big concern of a second wave, if those parameters are not too high, then we can move to the next phase. And if we continue to plateau in numbers, we can continue to move into the next phase. The worst possible thing will be for people to think the virus is gone, the crisis is over, and get together with 150 people without masks, hugging and kissing and spreading the virus, because we're just going to see an onset of a second wave. And again, thank you, President Cooper, for the honor of being able to participate in this function.
Thank you, Dr. Preston, and thank you for your participation and your knowledge. I'd now like to call on Chairman Mike Lorino of the St. Tammany Parish Council. Chairman.
Thank you, Mr. President. Before I get started, and I'll make mine short, I'd like to thank you and say welcome to the parish president's position, just a little over 100 days. You know, there's always good and bad, and I think this pandemic will allow you moving forward in your presidency to understand what needs to be done, the communication involved, and I think St. Tammany, as bad as this is, will be for the better for that. So I'd like to say thank you for that. Secondly, I'd like to thank Chris. I've known Chris for a while, and a great job. As you know, Mr. Masingill, when this first started, you and I had some lively discussions. But nevertheless, I knew you would accomplish what you needed to accomplish, and you have. And that's a testament to you, but more importantly, to the people that President Cooper put on that commission. So I just want to say thank you on behalf of the council to President Cooper and to Chris for the job that you all have done. It was remarkable. More importantly about that, as the president said, when I read it, he had 50% in a lot of things moving forward. So we were ready. I'd like to tell you, I'm a firm believer in 50%. I think it should be 50%. But I'm not the parish president, and the parish president will do what he needs to do based on the governor's restrictions. But I still would like somebody to look at that. But that's my personal opinion, because I think we could use that, and I think the community could use that, whether you take employees out of the 50%, whatever it is. But I think that's very important. But I need to applaud you for having that in the preliminary draft. And so thank you. I'm going to talk about one thing that I saw yesterday and today. And Dr. Preston made the statement, a mask. Yesterday, my wife sent me to Home Depot, and I went to Home Depot. And there must have been half of the people in Home Depot without a mask, standing very close to me. Well, if you don't want to wear a mask, stand at not 6 feet, stand about 18 feet. That should be in the rules. But I know we live in the United States of America, and everybody has a right to do what they feel like is correct. As I do when I wear this mask to protect you, you still have the right not to wear a mask and maybe not to protect me. There's nothing I can do about that today. But I believe and I implore the people of St. Tammany Parish, if we want to go to phase 2 and phase 3 and get out of this predicament, please try to put your reasons down and wear the mask, and let's see if that works. Because you know what's going to be said if it doesn't. Half the people didn't wear a mask and we're starting over again. That's a bad thing. I'd rather be half the people didn't wear a mask and we didn't need to, and we're moving forward. And I'm going to close on that and say thank you very much once again. Appreciate it, Mr. President.
Thank you, Mr. Lorino. Now I'd like to call on Clarence POWE, Director of Homeland Security and Emergency Preparedness for St. Tammany.
Thank you, Mr. President. First, I'd like to reiterate on a couple of things that were just said here. Ms. Masingill mentioned that, hey, guess what? The pandemic has not gone anywhere. Okay? The coroner mentioned, Dr. Preston says, hey, the threat, the risk is still there. So a lot of different things have been said, especially when it comes to keeping yourself safe, the social distances, okay? All those different things. You've heard it a number of times. Now, during the emergency response phase, that's the things that we're responsible for. We're still in that response phase. We want to make sure that we provide the necessary resources to keep all of our first responders, law enforcement and fire and EMS, keep them healthy and safe. But also, with a nursing home and assisted living facility, we want to make sure that they have the proper resources for keeping themselves safe. During this phase 1, we also took on the responsibility of ensuring that those clinics, okay, and those medical offices that's having difficulty getting those PPEs, we want to make sure that we provide that for them, okay? So we'll have a good, safe, and healthy return. So we're just asking you to continue what you're doing. We're still in this fight. We're not losing, okay? So we want you to help us all keep each other healthy and safe. Thank you, Mr. President.
Thank you. Thanks to all the speakers this afternoon. I'd like to say that moving into phase 1, this is an opportunity for many of our businesses that were closed heretofore to at least open their doors on Friday moving forward, even in a restricted manner. Our businesses are the bread and butter, or the heart and soul of our communities here in St. Tammany Parish. Our small businesses, our restaurants, we're ready to get them back open, and we're prepared to do so. We're ready for our nonprofits to be able to hold their events, their fundraising events, as we move forward. We're ready for our citizens to get their jobs back as our businesses reopen. This is what we're fighting for each and every day, for our citizens, for our business owners, for our restaurants, for our professional services as we move forward. Please heed the precautions as we go through this public health crisis. It's not over. It's up to our citizens to take the personal responsibility so that we are able to move forward in a safe and responsible manner in the weeks and months to come. Thank you, and I'll be happy to answer questions. Sarah?
Originally, the phases were kind of spaced 2 weeks apart, so have y'all changed that to 3 weeks apart, or is that just for phase?
Well, this particular phase is 3 weeks. I believe that the purpose of that was to, or is to, be able to evaluate the number of positive cases and the medical statistics in the weeks to come, so that a decision can be made in 2 weeks to be able to open, or to be able to move to phase 2 on June 5th.
Like, I know in a perfect
Rob?
world, you would like everybody to adhere to these 25% requirements, but what would you have, given the risk to all of us, if somebody just decides to open their doors to 100%? What happens if a restaurant does that, given the risk to all of us, and do you have any enforcement mechanism in place?
Well, the enforcement, because the state fire marshal is in charge or responsible for overall capacities in restaurants and businesses, the state fire marshal is the responsible entity for making sure that those requirements are met. He may delegate that to local fire departments and fire districts in each parish around the state, but it will be up to the state fire marshal to do so. And we have a number for the state fire marshal, and I believe he may, through his website, have a way of making those types of complaints with regards to capacities.
But will local law enforcement or anyone be a part of, will it be more of just an honor system, or will they respond if you guys all get a tip that someone's, got a lot of gathering?
Right. I would believe that the state fire marshal will be responsible for the capacity issues, and if it's, the employees are not wearing masks or they're not sitting, we believe, and I believe, in not only personal responsibility, but personal business responsibility, where the business owners, if they want to be able to serve their customers in a safe and responsible manner, in a healthy manner, that they're going to comply with the requirements in doing so that when we do move to the next phase and we increase the capacity requirements, that they're not jeopardized from doing so. I believe our restaurant owners and our business owners want to protect the public as well.
Could you just talk a little bit about the decision, or initially you are hoping 50% capacity, and the decision to stick with what the governor had suggested at 25%?
Well, certainly. The Advisory Council, through its focus groups and through its research with other publications and best cases in other areas, was a recommendation in their draft report to me that restaurants should have the capability of opening at 50% capacity and meeting the safety and health requirements. That draft was presented to me Friday evening. It was also presented to the public on Friday evening and was posted on our website and the St. Tammany Corp's website. With the governor's announcement yesterday, we had to pull back on that simply because, and as you all have reported, that the parish may be more restrictive than the governor's proclamation, but not less restrictive. And a 50% capacity would have been less restrictive. Therefore, that's what the recommendation is. And that's how we're going to move forward in the executive order.
Were there any other changes between Friday and after the governor's announcement, or was the capacity the main thing?
Without being very specific, I think Chris could be a better person to answer it, but there were some changes that we were quite surprised that were allowed to open in the first phase as opposed to either the second or third phase. And one of those was the beauty parlors, the barber shops, nail salons were moved into the first phase. So that was a surprise, as well as the capacity limits were lifted on some of the larger venue sites as long as you're meeting the social distancing requirements. So there were a few surprises in there in the first phase that we will adhere to.
Well, the first thing I would say is that what I've learned about the businesses and entrepreneurs in St. Tammany Parish is that they're amazingly resilient. They're strong business owners. They love being in St. Tammany Parish. They love providing a livelihood for their people and a product for us to utilize. And these restaurateurs and other business owners are adapting. They're evolving. They're switching their market, their supply chain. They're figuring out the options that they have available so they can continue to provide a livelihood to our people. That's their number one priority. Yes, we wanted it to be 50%. We recognize it is an additional financial burden on them, and they have to make that decision ultimately at the end of the day. And we're seeing them do that. Some will, some won't. Hopefully, we're putting them in the best, strongest position so they can recover quickly.
Have you heard of any business in general, restaurants that already said, I'm shutting down for the few? You've heard of that? And what do you think, 25%? You understand the economics of that. I mean, is that something they can really manage? I'm sure you're right.
Yes, sir. We have heard of some. We're taking the position, let's wait and see, provide the technical assistance that we can, make sure that we can best utilize these relief programs that are coming from the federal government. We want to make sure people are in the pipeline. These loans are still available. Things are still accessible. We're trying to put them in the best position to be successful. Some will not, but most of them will. And the response that we're getting is that, yes, we don't like it. The 25% is definitely a major financial impact. We wish it was more. But what we also know is that let's hang tough. Let's get to this next gating criteria. Let's get into phase 2. Let's see the opportunity to increase that occupancy limit by adhering to the social distancing, the strict public health guidance that's out there, and let's keep pushing the envelope as much as we can. And we haven't stopped advocating, and I think this is very important, Mr. President, and you've reinforced this with me, is that we continue to advocate to our state economic development partners, the governor's office, his state team. We constantly communicate, look, here's what's happening on the front lines. Here's the circumstances from an economic development standpoint that we're dealing with at the local level. And they fully appreciate that and understand that. But it's a balance. They're trying to balance public health and the economic health at the same time.
Some of these state officials, and they react to it. You guys talked to the governor at all, and he said they all feel like it's 25%. It's like, all these businesses, they'll be fine. Is that really the reaction generally got?
Well, first of all, let me say that nobody is just blowing anybody off, right? That's not the impression that we're getting. Everybody understands that this is a very difficult economic times, which is why I think that the state leaders are also trying to evaluate in a very prudent way, how can we get the economy back open? Look, we saw several areas that got lifted that we thought was going to be in phase 2 and phase 3, and we quickly adapted, and it was like, great. Let's go. More businesses that we can open in a moderate phase approach, we're for that. And so I would not try to communicate that the response at the regional level or at the state level has been one that they don't recognize the situation that we're in.
Chris, are they free to add outdoor seating?
Yes, they are. Up to the 25%.
Up to 25%?
The 25% also adheres to the outdoor space based on specific. There's square footage elements. If you go to opensafela.gov, you put in your square footage, you get back exactly what you can do, even with the layout of your table settings by the state fire marshal.
But is a new limit set based on the outdoor space you have, like a parking lot? Like if you got a big parking lot outside, can you take up 25% of the space of the parking lot if you wanted to?
No, my understanding is the 25% is for the indoor space, and in the outdoor space, as long as you can still accommodate, but you still need to register and get that accommodations back from the fire department. I would be hesitant to speak on that specifically, Rob, without double checking with the fire marshal.
I have a question for Dr. Preston. Do you feel like we have adequate testing capacity in St. Tammany Parish?
I think that we are moving towards adequate testing. We have certainly improved since this has begun. We're not at the ideal number, and the state is not yet at the ideal number of contact tracing, which is really going to be a critical component of limiting disease. But I think that we have enough now that are readily available through the existing healthcare resources, that if an employee comes into your business and they have 100.8 temperature, that they can be referred for a very prompt test and get a result in a short period of time.
Dr. Preston, while you're up there, any more to say on the strike forces that the state health department is sending in on the nursing homes? I mean, 1 in 3 of the deaths have been in nursing homes. Is it too late to do anything at this point, or do you think they can be effective?
Well, I don't think it's too late to mitigate what risk we can. And I think that from my understanding, what the strike forces are doing are deploying hospital-based infection control specialists who then can go to the nursing homes, review their processes, and identify places that can increase the protection of their residents. And it seems like a year ago that I was up here with President Cooper But when we pointed that out, I think he very quickly got hold of Clarence, and Clarence started working with nursing homes to provide the PPE that they need. So I think that there are still some inevitable deaths coming out of the nursing home population. They are essentially quarantined, and if they can plateau those deaths out, then that'll be a win.
On a different or related topic, the church
Okay.
situation, I've talked to a number of pastors who are beyond upset. The church is being considered with businesses. One today was telling me, this is basically a violation of the First Amendment, which says churches have the right to meet and all that. And yet here, they've just been ordered to close. I mean, they're really upset about it. And one other pastor, I've talked to a number of them because they're getting ready to start up, and one of them said, look, we're not going to turn anybody away that comes. Have you heard any, have you talked to pastors, are they just all in compliance, or what do you hear about that?
Well,
Hey, it's a big issue, these guys are very upset, they are.
the churches are not being closed. The churches and places of worship are being allowed to open at 25% capacity and outside seating as well. I went to my first on Sunday, an outside setting at a Catholic church in Covington, and it was outside, and it was all the precautions were taken. It's moving forward. The churches, the places of worship are moving forward in opening to serve their congregation and their parishioners.
Send the police over if they have too many.
Mike, can I address that, please?
Yes.
So I have a lot of friends who are in the faith-based community, and they've been communicating with me. There's a particular pastor who literally calls me every day for an update. And the vast majority of the pastors that I have talked to said, we don't want to risk the health of our congregation. And so if we need to, and that many are having Zoom services, live streaming services, if we need to limit, and in my church, you can have 10 people, you sign up for it, and the first 10 get to go into Mass. They then come outside, and there's drive-through communion. So they are adjusting to that. And a fair number, of course, of the pastors are high-risk people. And that may be a point that we didn't really push home throughout this reopening phases. High-risk people, elderly people with heart disease, diabetes, immunocompromised because of cancer, obese, they are really encouraged to continue to stay at home as much as possible, to call on neighbors or grandchildren to go to Walmart to get their groceries and bring it back to them. And so, many of the congregants and pretty much all of the pastors that I talked to said they want to do this responsibly. They don't want to be responsible for bringing it into their congregation. And several weeks ago, actually, I sent out an email and I said, prepare to be reopening. Anybody in your congregation that can sew masks, start sewing. And so for everybody in your congregation. And if you have extra ones, reach out to another congregation and just keep sewing, keep sewing, keep sewing, and distributing masks.
Okay, unless there are any other questions, Rob?
Will there be any signage on restaurants as to what their capacities will be, or will that just be strictly up to the restaurant?
I believe that's a requirement. The State Farm, I believe it's a requirement to put their 100% capacity requirements. So I do believe that that's a requirement of the State Fire Marshal in order to open and serve. Again, I'll emphasize going to the website opensafely.la.gov to get all the information with regard to safely opening your business in St. Tammany Parish. I want to thank you all for being here. I'll be happy to address you one-on-one, social distancing with masks. After this, I want to thank Dr. Preston, Council Chairman Lorino, Chris Masingill, St. Tammany Corp CEO, and Clarence Poe for their participation in today's press conference. I hope it's been informational and to you all. I want to thank the media for being here as well. Thank you very much. Have a great afternoon.